everyone, welcome back to our channels. In today's video, I was really busy so I couldn't make any additional video lately, but I'm so happy I can resume another session. We're diving into another session of mock exam focused on BACB Ethics Code E3 Responsibility in Practice. If you've been following along, we've already covered these topics in previous videos, but today's scenarios will push your critical thinking skills even further. These mock exams are designed to help you master the nuance of this ethics code with real world scenarios you might encounter as a behavior analysis. So grab a notebook and get ready to test your knowledge, and let's strengthen your ethical decision making skills together. Mock exam 1. A 10-year-old client with a developmental delay is receiving services from multiple providers, a behavior analysis, speech therapist, and occupational therapist. In a team meeting, the analysis realized the behavior plan conflicts with the speech therapist's communication strategies. For example, the behavioral plan used a token system, while the speech therapist relies on naturalistic communication strategies. The child appears confused during therapy, switching between systems and showing signs of frustration. If the professional don't align their approaches, it may delay the child's progress. What should the analysis do? 1. Ignore the inconsistencies to avoid conflict with other professionals. 2. Work with the other providers to align the goals and clarify roles. 3. Change the behavior plan to match the other providers' plans without discussion. 4. Inform the parents that the providers are not aligned and suggest they prioritize one service. Okay, let's look detail. Number 1 is incorrect because the ignoring conflicts compromises service quality. Number 2 is correct because according to code 3.10, emphasize the importance of a collaboration to align services. Open discussions among providers will help create consistency and avoid confusing for the client. Number 3 is not ideal since changing the plan without discussion could create further problems. And then number 4 is incorrect as well. Um, it places unnecessary burden on the parents instead of resolving the issue. Therefore, the correct answer is number 2, work with other providers to align the goals and clarify laws. Okay, let's move on. Mock exam number 2. A parent asks the behavior analysis to adjust their child's intervention plan to account for a new dietary supplement that's supposed to improve behavior. The parents explain that a friend's child benefited from the supplement and insist it will complement the therapy. The analysis, however, is unsure about the supplement's safety and worries it might interfere with the intervention. The parents becomes defensive, saying they don't need the analysis approval to give the supplement. What should the analysis do? Number one, refuse to modify the behavior plan unless the parent discontinues the supplement. Number two, recommend that the parents consult with physician to ensure safety. Number three, adjust the behavior plan as requested by the parents. Number four, suspend services until the parents agrees not to use supplement. Okay, you get it? Number one is incorrect because refusing without offering alternatives might harm the relationship with the parents. Number two is actually correct because because of the code 3.10 emphasizes the importance of involving other professionals when needed. Um, physician's input the patient's inputs ensure that the supplements won't interfere the therapy. Number three is not appropriate because making changes without consulting other experts could have negative consequences. Number four is excessive and disruptive to the child progress. So the correct answer is number two, recommend that the parents consult with the physician to ensure safety. Okay, let's go to mock exam 3. A behavior analysis is assigned to provide services to the child of the family friend. The analysis initially thinks they can maintain professional boundaries, but the parent soon begins making personal requests, such as asking for favors unrelated to therapy. During one visit, the parents asked the analysis to babysit the child while they run errands. The analysis feels uncomfortable but worries that refusing might strain the friendship. What is the best way to address this situation? Number one, continue providing services without addressing the dual relationship. Number two, discuss the dual relationship with the parent and supervisor to explore options. Number three, immediately terminate services. Number four, agree to babysit temporarily to maintain the friendship. Okay, let's see um, from the number one. Number one is incorrect as it ignores the potential impact of the dual relationship on service quality. And number two is correct answer because of the code 3.11 emphasize managing conflicts of interest through open communication and consultation. It's important to address the relationship early before they escalate. Number three is not necessary unless the conflict cannot be resolved. Number four is inappropriate since it crosses professional boundaries. So therefore, the correct answer is number two. Discuss the dual relationship with a parent and supervisor to explore options. Okay, number four. The parents of the client give the behavior analysis an expensive gift as a thank you gesture for helping their child make significant progress. The analysis feels uncomfortable accepting the gift, worrying that it may create an expectation for future favors. However, the parents insist it's cultural tradition and declining the gift could offend them. What is the best course of action? Number one, accept the gift to respect the parent's cultural tradition. Number two, politely decline the gift, citing professional boundaries. Number three, accept the gift but document the interaction. Number four, ask colleague for advice on whether accepting the gift is acceptable. Okay, are you ready? Um, let's look from the number one. Number one is incorrect since cultural sensitivity doesn't override ethical like obligations. Number two is actually correct because uh, according to Code 3.11 requires maintaining boundaries to avoid potential conflicts of interest. Number three doesn't eliminate the conflict of interest. Number four is unnecessary because the analysis should know the ethical guidelines. Therefore, the correct answer is number two, politely decline the gift, citing professional boundaries. Okay, let's move on. Mock exam 5. A supervisor feels overwhelmed by feedback, saying it's too vague to implement effectively. The behavior analysis regularly tells the supervisors do better without offering concrete strategies for improvement. As a result, the supervisors becomes frustrated and unsure how to improve their performance. What should the analysis do? Number one, continue giving the same feedback to motivate the supervisors. Number two, provide specific feedback with examples of how to improve. Number three, reduce feedback to avoid overwhelming the supervisors. Number four, let the supervisor figure out how to improve on their own. Okay, let's the detail. Uh, Actually, the correct answer is number two. Provide specific feedback with example how to improve, because the supervisors feel overwhelmed the feedback and it's too vague. So behavior analysis provides specific feedback with examples, so that would be helpful their like progressing. So number one, continue giving the same feedback to motivate the supervisor is not correct because of the vague feedback. It's not really help to improve. Number two is correct answer, and number three um, is not appropriate since reducing feedback might hinder growth. Number four, places too much responsibilities on the supervisee. Therefore, the correct answer is number two, provide specific feedback with example of how to improve. Okay, let's move on. Mock exam 6. A behavior analysis supervising a trainee notices that the trainee is not documenting client's progress consistently. When the analysis when the analysis gives feedback about the issue, the trainee becomes defensive, saying they are too busy managing other responsibility. But the analysis is concerned because accurate documentation is essential for tracking progress and meeting ethical requirements. If the issue isn't resolved, the client's services could be compromised, and the trainee's performance may reflect poorly on the analysis supervision. What is the best courses of action? Number one, ignore the trainee's defensiveness and continue supervision as usual. Number two, provide immediate corrective feedback, offering strategies to improve documentation practices. Number three, report the trainee's behavior to their certification board. Number four, reduce the trainee's workload to make time for documentation without addressing the issue directly.
얘들아, 아빠 영화 보는 거 보지 마, 은솔이. 내가 참 그거 보고 있니?
Okay, let's look detail. Actually, this happens a lot with trainees. Um, so when I start with the BCBA, I'm also really having hard time for the trainees. Um, they're um, they're very defensive for my feedback. So the correct answer is number two. Provide immediate corrective feedback, offering strategies to improve documentation practice. That's correct answer. So we can ensure the services meet professional standards, and offering specific strategies to improve will help the trainee without um, um, without sharing them for mistake. Number one, um, ignore the trainee's defensive and continue supervision as usual is not correct because ignoring problem will not lead the improvement. And then number three is not appropriate unless the issue persists after corrective action. Number four, avoids addressing the root of the problem, which is the trainee's time management and accountability. So the correct answer is number two, provide immediate corrective feedback, offering strategies to improve documentation practices. Number seven, behavior analysis is hired by school district to provide behavior services to a student with autism. The district had outlined that all reports and progress updates should be channeled through the principal's office to streamline communication. A few weeks into services, the students' parents reach out directly to the analysis, requesting weekly updates on their child behavior and progress. However, principal insists that all communication with parents must come through the school to avoid misunderstanding. The analysis worried about following both ethical and institutional policies. What is the best course of action for the analysis? Number one, following the district's instruction and avoid direct communication with the parents. Number two, inform the parents that they must contact the school for updates. Number three, explain the scope of services to parents and provide them access to report as legally required. Number four, stop services until both parties agree on communication protocols. Okay, let's look detail. Number one is incorrect because the school cannot limit the parents' legal right, right to information about their child's services. Number two, shifts the responsibility to parents, potentially creating unnecessary delays in communication. Number three is correct for this question because of the code 309 that ensures that the legally authorized representative, like for example parents, are informed about the services and given access to relevant documentation. Ethical obligations require to the analysis to communicate essential information to parents regardless of the school's preference. Number four is unnecessary because services should not be interrupted over procedural conflicts. So the correct answer is number three, explain the scope of services to the parents and provide them access to reports as legally required. Okay, let's move on to mock exam 8. A behavior analysis is working with child through a grant funded program managed by a state agency. During a meeting, the parents expressed that they want additional behavior therapy hours beyond what the grant covers, as they believe it will benefit their child. However, the analysis knows the extra hours are not part of the agreed upon service plan and worry that providing them could create a conflict with the grant terms. The parents become frustrated, feeling their requests are being ignored. The analysis need to resolve the situation without compromising the funding agreement. What should the analysis do? 1. Provide the requested services and documents them separately from the insurance covered service. Number 2. Inform the parents that any additional services must be approved by the insurer first. Number 3. Proceed with the requested services and bill the insurance company. Number 4, communicate with both the insurer and the parents to clarify what services can be provided. Okay, are you ready? Um, Number one is incorrect because providing unapproved services can create documentation and accountability issues. Number two, unfairly shifts the burden to the parents to address the issue with the insurer. Number three is unethical since it involves billing for unauthorized services, which could lead to funding termination. Number four is correct because of Ethics Code 3.09 emphasizes transparency with all parties involved in third-party services to prevent misunderstandings. The analysis should ensure the parents understand the limitations of the grant while working to explore other options if needed. Therefore, the correct answer is 4. Communication with both insurer and the parents to clarify what services can be provided. Okay, mock exam 9. Behavior analysis begins working with new family and explains that some of the child behavioral data will be shared with the funding agency to maintain coverage. The caregiver is visibly uneasy and asks if there is any way to keep the information private, citing concerns about the potential stigma. The analysis understands the caregiver's worries but also knows that failure to submit report could be jeopardize the services. The analysis needs to find a way to meet both the caregiver's needs and the program requirements. What should the analysis do? Number one, respect the caregiver's request and keep the report confidential. Number two, provide only partial report to the funding agency. Number three, explain that confidentiality has limits and report must be shared according to the funding agreements. Number four, stop services until the caregiver agrees to the reporting requirements. Okay, let's read detail. Number one is incorrect since it would be breach the funding agency's requirements. Number two is not acceptable as well, as providing incomplete reports can be mispresent the child progress and impact future services. Number three is correct answer for this question because of the ethics code 3.10 requires analysis to clearly communicate the limitations of confidentiality upfront, upfront and when necessary. The analysis should be empathetic while ensuring the caregiver understands that the submitting reports is not negotiable aspect of the service agreement. Number four is excessive. Number four is excessive and not necessary to resolve the situation. So the correct answer is number three. Explain the confidentiality has limits and reports must be shared according to the funding agreements. Okay, last question. Number 10. During a therapy session, a teenager client tells a behavior analyst that they have been using illegal drugs with friends. The client pleads with the analyst not to tell anyone, saying they fear punishment. The analyst feels torn, wanting to maintain client's trust, but also recognizing the potential safety concerns. The analysis is unsure if this disclosure must be reported immediately or if more information is needed to determine the right course of action. What is the best course of action? Number one, report the information to law enforcement immediately. Number two, document the disclosure but take no further action. Number three, consult with legal or clinical experts about reporting obligations. Number four, inform the client that their disclosure may need to be reported. Okay. Um, let's see. Number one is premature without consulting legal or clinical experts to confirm the need of report. Number two, um, number two alone is insufficient as the situation may require the further action to protect clients. Number three is good step but must be accompanied by inform the clients. Number four is correct for this question because of the ethics code 3.10 requires behavior analysis to inform clients about the limits of confidentiality. The analysis should also explain the potential consequences of the disclosure to maintain transparency. Therefore, the correct answer is number four. Inform the clients that their disclosure may need to be reported. Working through today's mock exam, Ethics Code 3 responsibility in practice are essential for maintaining professionalism and integrity in your practice, and mastering these concepts takes consistent effort. We will continue practice with more mock exams on this ethics code in the next video. So make sure to join us again and don't forget to press like, subscribe, and hit the notification bell so you don't miss out on future sessions. Thanks for watching and see you in the next video.